Welcome everybody. It's a beautiful day outside, which is all the better for us all to get together. So before I start, we would like to acknowledge this land that we meet on today is the traditional lands of the Kaurna people, and that we respect their spiritual relationship within the country. We also acknowledge that the Kaurna people as the custodians of the Greater Adelaide region, and that their cultural and heritage beliefs are still important to the living Kaurna people today. So the purpose of the session today is to give a little bit of a background of why we are here and why we're providing this training session. We're going to look at the directions for the residential aged care facilities, predominantly number 6 relating to PPE and what is appropriate PPE for residential aged care facilities. Then we'll move on to discussing the signs and symptoms of COVID, how COVID's transmitted, and then how we can actually look at preventing the transmission of COVID in your facilities. And then we will focus on personal protective equipment and talk about the different types of PPE, gowns, masks, eye protection, and also look at the principles of donning and doffing PPE and why it is so important that people are actually trained to don and doff PPE appropriately. There'll be then some time for questions, and we'll move on to a practical session. So I hope you find it useful. So if we think about a risk profile for aged care facilities, as we know, there's been high transmission of COVID in Victoria, and currently, or as of the 6th of September, there's been over 1,600 active cases due to outbreaks in residential aged care facilities. And these outbreaks are just not including residents alone. This has included staff as well. And the possible contributing factors to this increased risk of transmission due to staff actually working between different facilities. So a staff member may pick it up at one facility and then move to another facility and potentially spread COVID there. Lack of early recognition of COVID-19-like symptoms and isolation of residents. So finding that a resident is unwell but they haven't been popped into precautions or isolated from other residents early enough, so that gives the COVID virus a chance to spread. And also inadequate PPE donning and doffing competency and education, and that's where we're really wanting to focus on today, is making sure that you're given the skills to actually train others to don and doff PPE appropriately, and that you can sign them off and know that they're competent in that donning and doffing sequence as well. So I just thought I'd just give a brief overview of the residential aged care facility directions. So it was enacted on the 27th of August, and there's 11 components to the direction. Has everyone had a look at the direction? Are familiar with it? Excellent. So number 6 relates to the additional limitations to certain persons, and it requires that people caring for residents wear appropriate PPE. And in the direction, it doesn't actually specify what is appropriate PPE, but SA Health has defined that as being a surgical mask. But of course, if that resident has a requirement for transmission-based precautions or any other precautions that requires PPE, or if you're doing working with that resident and there's going to be contact with blood and body fluids, you'd still need to wear gloves as well. So the minimum would be a surgical mask when you're within 1.5 metres. Also, number 6 relates to that infection control training is required, and that has been determined by SA Health, and I'll go into that in a bit more detail in a minute. And of course, not working within your different residential aged care facilities. Criteria number 5 relates to workers and visitors requiring a vaccination before a seasonal influenza vaccination before they actually enter a residential care facility. So that's just a reminder. And also that people can't enter the facility if they've had a COVID test and waiting for that result, or they're positive, of course. You would hope that they wouldn't be coming in. For further information regarding the directions, there's links on the SA Health Aged Care Restriction site. If you refer to that web page, it's really useful. It has a lot of information regarding aged care and COVID management, and has a lot of really helpful links as well. Appropriate PPE. So as I said in the direction, it says a person who provides nursing, medical, allied health or personal care services to a resident must wear appropriate personal protective equipment in accordance with the Australian guidelines at any time they are providing services and cannot maintain a distance of more than 1.5 metres. And again, I'll just repeat that the minimum would be a surgical mask in addition to other precautions as required. With the training, all employees or contractors who provide personal care or nursing care to residents at a RACF must complete the COVID-19 infection control training of a kind, frequency and date determined by the Department of Health and Wellbeing. So that date is now the 1st of October. So hopefully the majority of you have already completed this training. And to comply with the direction, you must keep records of the training that you have actually undertaken as well, and refresher training will be advised in due course. So has everybody completed the new module, the e-learning? Okay, excellent. If you've got any feedback, you can pop that into your evaluation at the end. So let's talk about COVID-19. So what is it? So it's an acute infection that's caused by respiratory syndrome coronavirus 2, so SARS-CoV-2, and it's related to the SARS we knew years ago, that's SARS-CoV-1. The majority of people infected will develop mild respiratory illness, with a minority developing severe illness. And of course, as we know, age can play a role in the comorbidities and the risk factors for developing that more severe illness. Asymptomatic COVID infection can occur, so you can be infected with COVID, you may not have any symptoms and be spreading the virus unknowingly. You can also have pre-symptomatic transmission, which can be up to 48 hours before symptoms commence. So I might be feeling great, I've been out mixing with people, 2 days later I become unwell, I'm detected as having COVID, but it's too late. For those 2 days before, I've actually been spreading the virus potentially. It doesn't work that way for everybody, but it's certainly a risk factor. So, you know, it's really important that physical distancing is maintained at all times, even in everyday activities. Severe illness is normally associated with increased age and other comorbidities. And the virus is not very hardy in the environment, but has been shown to survive in small numbers for up to 3 days on some surfaces. So cleaning is a very, very important process in ensuring that we're not spreading COVID. Other signs and symptoms, so fever or history of fever or chills. Noting though that these may be absent in the elderly. So sometimes the elderly can present a little bit differently to younger people. Acute respiratory infection is also another sign and symptom. Common symptoms as dry cough, sore throat, shortness of breath, or even a runny nose. Acute unexplained loss of smell or altered sense of taste has been noted. And also the onset of clinical symptoms compatible with COVID-19 can include headache, myalgia, nausea, vomiting, and even diarrhoea can be a symptom. So, you know, it's pretty hard to pinpoint that this is COVID without that testing, but we can pinpoint really quickly that someone needs isolation and to go into precautions and to make sure that they're separated from other people. Other symptoms that are common in older persons can include headache, muscle and joint pains, chills, nasal congestion, coughing up blood, we hope not, watery, sticky eyes, and older people may sometimes also experience confusion or behavioural change, worsening chronic conditions of the lungs and loss of appetite. And I would really recommend that you actually go to the CDNA national guidelines and for the prevention and public health management of COVID-19 outbreaks in residential care facilities, because these are updated regularly and sometimes those symptoms are changing. The more evidence, the more we know about COVID, things do change. So it is important to keep up to date. So how does COVID-19 transmit? I guess there's three main ways. Direct close contact with an infectious person, and again just reminding you that that's including the 48 hours before they have symptoms. Contact with droplets from an infected person's cough or sneeze. So hence it is just so important to keep that 1.5 metre distancing and also practice good respiratory etiquette at all times and hand hygiene. And also touching objects or surfaces such as doorknobs, tables, light switches, other residents, sharing equipment, because these can have droplets from an infected person. And then if you're touching your face and your mouth and your nose, you can inoculate yourself and give yourself an infection. And it's amazing, one of the hardest things to do is not touch your face. I don't know if everyone's become more aware now that COVID is here, but it's a basic principle of just cleaning your hands before you go near your face, clean your hands again. And just to remember the SA Health logo campaign that we've had going for a number of years now, wash, wipe, cover, don't infect another, and there are lots of resources on the SA Health web pages for the wash, wipe, cover program. It's those basic principles that will help. So if we talk about infection prevention and control, hopefully we're all practicing our standard precautions at all times, regardless of known infection. So standard precautions protects us as a healthcare worker or a care worker or a staff member, and it also protects our patients and residents from infection. And that includes hand hygiene, as per the 5 moments for hand hygiene, using PPE when there's a risk of body fluid exposure, your respiratory and cough etiquette, as I was talking about before, safe use and disposal of sharps, and that routine environmental cleaning, focusing on frequently touched surfaces. Cleaning and reprocessing of equipment. The good thing is that COVID-19 will easily be activated by some disinfectants, by common disinfectants, including bleach. So that's a good thing, but you still need to clean your environment before it's bleached. There's a list of products on the TGA website that are suitable and work against COVID. You might like to refer there. And there's also products that are a combined detergent disinfectant product. So that means that you're cleaning the environment and disinfecting at the same time in the one step. So that can be handy to know. Also, standard precautions is looking at your waste management for your general and clinical waste, and then appropriate handling of linen. So making sure it's managed and stored properly, and whether you would need to perform hand hygiene before and after managing waste or linen. So standard precautions alone are not enough to prevent the spread of COVID-19 transmission. And what is recommended is that contact and droplet precautions are also implemented. So it's really important that COVID-19 spread is minimised. And as soon as you can actually identify someone with signs and symptoms and isolate them, you can then get them into droplet and contact precautions. And these are in addition, remember, to your standard precautions. So it doesn't mean that everything else goes out the window. So you still practice your basic standard precautions and then transmission-based precautions as well. So if you're caring for someone who is a suspected, probable or confirmed COVID-19 resident, you would have contact and droplet precautions, which would include a gown, hand hygiene of course, gown, surgical mask, eye protection and gloves. Hand hygiene is just so important in this process as well, and we repeat our hand hygiene steps numerous times when we're donning our gowns, donning and doffing. So it is a key measure to minimise the transmission of infection. And has everybody encouraged their staff to complete the 5 moments for hand hygiene online module? Excellent, yeah, it's really good, no cost, and it does explain the key times when people need to be performing their hand hygiene. So you can clean your hands either using soap or water, or you can use an alcohol-based hand rub. Now, soap and water is absolutely necessary if you've got any gross or visible contamination on your hands. You must remove it and be able to wash it from your hands. But if your hands are not visibly soiled, the gel is fabulous. It's at the point of care, so you don't actually have to go looking for a hand basin. You can place the gel where you need to have it for use. And it also contains emollients, which means that you're moisturising your hands at the same time. So it's actually quite gentle on your skin. But if anyone is having problems with the gel, then they should seek further advice from their worker health team or infection control lead. Hand hygiene, the way it works is just to reduce the microorganisms present on all surfaces of your hands and wrists, and it should be performed by everyone, anyone coming into the facility, anyone going to have contact with a resident, and after leaving the facility as well. And hand hygiene must be performed every time gloves are removed, and I've got a little bit more about gloves in a minute. So has everyone watched the video with Alison? Excellent. So Alison McMillan is the Chief Nursing and Midwifery Officer for the Department of Health, and the video is excellent. It shows how to don and doff correctly, and we would recommend using that as your video link as a resource to teach others. So now I'll talk about personal protective equipment in a little bit more detail. It's important to know that PPE is part of an infection control bundle. So, like I've said, I've talked about droplet precautions, I've talked about standard precautions. You would never use PPE alone. PPE isn't going to protect you if you're not cleaning the environment, if you're not cleaning your hands, if you're not isolating patients. So it's a bundled approach. It's not the complete answer. And it's worn to protect staff against the transmission of COVID through your mucous membranes. So of your eyes, your nose, or your mouth. So they're your portals of entry for COVID to get in and cause infection. So let's talk about gowns. So they're worn when there is close contact with an infected person, materials or equipment or body fluids. So basically you're protecting, the purpose of a gown is to protect your clothing. You would need to remove or change your gown between contact and if contaminated, damaged or torn. So even if you're with a resident and it gets torn for some reason, you would then need to leave, take off your PPE and put a new gown on. It provides protection of the worker's exposed body areas and prevents contamination of clothing, like I said, and it ensures that it's important that you put your gown on properly, and we'll show that through the practical demonstration, that it's actually secured properly and that you're covering the whole of your back. So, because you can't actually see what you're touching in the environment directly, so making sure you're covered properly. Surgical masks, they provide a physical barrier between the mouth and nose of the wearer and prevents droplet transmission of droplets during contact. So they're available in different levels. I think most residential care facilities would have a surgical mask level 2 or 3 available, and the 1 to 3 just refers to the different level of fluid resistance of the mask. So, so you need to change those masks after each use. or after clusters of care. So if you're going to wear them for an extended period of time, it's important that you wouldn't wear them for longer than 4 hours, or if they become moist or damaged or compromised in some way. There's a PPE optimisation fact sheet. There's a link in the PowerPoint that you can refer to, and there's also a resources page at the end of this presentation that has the link as well. And this PowerPoint, I don't know if I mentioned, will be going up onto the SA Health website for you to refer to use as your own, as a training tool for yourselves. Avoid touching the mask and face during use when doffing or disposal. Really, really important, because if you are touching your mask with contaminated hands, you can still inoculate yourself through your eyes and contaminate your mask. And always perform hand hygiene before donning and doffing of mask. And we'll again do a bit more work with that in the practical session. Now on to protective eyewear. So protective eyewear can consist of safety glasses, goggles or face shields. And it's really important that protective eyewear is worn over your glasses, prescription glasses. Your glasses actually aren't suitable as protective eyewear, because when you look at mine, you can see that it doesn't actually stop the droplets coming in through the side, and they can fall down to behind my glasses. So you must wear protective eyewear over the top of your prescription glasses. It's used to shield eyes from potential exposure to infected droplets, and the lenses and side shields offer that additional barrier protection. And they should be cleaned or disinfected after each use, if they're reusable. If they're single use only, they cannot be cleaned. You must discard them and then get a new goggles or face shield. So it's important that you look at the manufacturer's guidelines and understand the type of PPE that you have, and make sure you're not reusing it if it is classed single use only. Moving on to gloves. So microorganisms can gain access to hands via small defects in gloves. So the fact that you're wearing gloves does not negate the need for hand hygiene. You still need to clean your hands before you put on gloves and after you take them off. It's really important. And the other thing is you can contaminate your hands on removal of gloves. So again, you need to clean your hands. They are single use only and should be changed between activities and if grossly contaminated. And they can also be a source of cross-contamination. I've got a really good video to show you in a minute. But people often think if I put on my gloves, I can now touch the environment, I can touch a resident, I can do what I would want to do because I feel protected. So I don't feel like I'm going to get an infection. However, those gloves can then spread germs. So I'll play that video in a minute. Never gel your gloves. The alcohol-based hand rub is not designed to work on plastic or latex or whatever the glove is made of. It's designed to work on skin. And if you're putting the gel on the gloves, this can potentially damage the material, making them ineffective. So really important to please make sure you're encouraging staff, if they do feel that their gloves are contaminated, that they take them off, clean their hands and put on a new set of gloves. So I'll just play you a little video now.
Hi, I'm Tina. I want to do a little demonstration about wearing gloves. I'm seeing a lot of people out in public wearing gloves right now. That's great. If you want to wear gloves, that's all fine. You absolutely can. But I wanted to tell you about cross-contamination. So let's say I'm in my car and I'm getting ready to go to the local shops. I put my gloves on. I'm at the shops and I reach for a can. I put it in my basket. And now you can see I have these germs. But they're on my gloves, so that's fine, right? So I'm walking along and I get a message. I reach for my phone and it's my son asking me to grab some fruit. And now I touch my face. It's itchy. And now my phone's ringing and it's my mum. She's an at-risk person and needs me to get her some supplies. Hi Mum, what can I get for you? I'm finished with the call and now look at all the bacteria I've spread with my clean gloves. I get back to my car, I open the boot to load the shopping, I reach for my car door handle and then I sit inside. So I'm thinking, I'm done with these gloves and I don't want these dirty gloves in my car, right? So what should I do? I should take them off appropriately and throw them in the bin. Now my gloves are off and my hands are clean, right? And then my phone rings again. So I pick up my phone. Hello? This is called cross-contamination. There's no point in wearing gloves if you're not going to wash your hands every time you touch something. There's just no point. Please practice hand hygiene, clean surfaces regularly, don't touch your face, and keep up social distancing.
So that is a really good video to show your staff. It really does get the message across that gloves do not prevent the spread of germs. Okay, so now we're going to move on and do a demonstration. So I'm going to ask Tina to come back and do the talking, and I'm going to do the demonstration so you get a rest from my voice.
Thank you, Lisa. Okay, so Lisa's going to demonstrate the donning and doffing procedure as per the updated sequence. So you may have noticed that the sequence has now been updated across the SA Health resources. Okay, so first thing she's going to do is do her hand hygiene, so making sure that whatever activities she's performed previously, so depending on what she's done, she's going to use alcohol-based hand rub for now, making sure that she cleans all of the surfaces of her hands, around the thumb area, and also a little area that we often forget around our wrists as well. So giving that nice and making sure that that's nice and dry so that she can put on her gown. And ensuring that the gown, so depending on your facility, you may have different types of gowns. Some of the, they're not always the fully, the wraparound gowns, but what we need to ensure is that they are well secured at the nape of the neck and at the back of the gown as well. So making sure that when they're being tied, that they are tied perhaps in a bow. And another nice thing is we've got lovely Chris, who will be Lisa's buddy, to make sure that she's actually has got that secured really well. So one of the things that we like to encourage staff is to actually work as a buddy team when they're applying their PPE, and particularly when they're taking it off. Next thing we're going to do is put on the mask. So we have the surgical mask with the loops. You may have the masks that have the ties, so depending on what your supply chain provides, they generally will have a flexible band at the top, which needs to be moulded to the nose, just so that we can ensure that we've got a secure fit with that. And then you have your loops or your ties that need to go up either around the ears or tied at the back of the head and at the top of the head, and just making sure that we mould that around the nose and across the cheeks. So depending on everyone has different size noses, so it can be, it's essential that we have that fitted well before we put on the next part of our PPE. Next, because she's wearing prescription glasses, she'll apply those back again, and then apply the goggles, which then give her a nice seal for her eyes, nose and mouth, which, as we said previously, is where we want to prevent transmission of COVID-19. Lovely. And the last thing she's going to do is put on her gloves, and just to ensure that there's no breach between the cuffs and the gloves, if you encourage your staff to pull the cuffs down halfway down to your hands, and then once you're applying the gloves, you've got a nice seal there, so that when you're moving around and performing your duties, that you don't tend to get a gap forming there. But if you do when you're doffing, then that's another opportunity to clean around the wrists as well. Fantastic. Okay, so now another good idea is to do that final check before you would go in and perform your duties. And you know, depending on how much manual handling and those sorts of things are happening, it may be that the integrity of that might be breached if there's any tears in gloves or those sorts of things. So making sure that there's a contingency built into plan with your workers. Okay, and now the next part of this is now taking off the PPE. I might just mention a little bit about fogging of glasses and those sorts of things. So just ensuring that if that is something that might occur, that there are a couple of little strategies you can use. We can probably talk about those when we go to our stations. But one important thing I did forget to mention as well, when you're ensuring that your staff have got their hair tied up, or if they're wearing turbans, or if they have beards as well, with the mask, making sure that they have additional protection, perhaps wearing a face shield if they don't have a good coverage of their mouth, particularly if they have a beard. We find that can sometimes be an issue. Earrings, so I guess most uniform policies might be that you don't wear dangly earrings, but they can also compromise when you're taking off your PPE, as well as removing when you've got prescription glasses on. So there's a lot of little contingencies that you do need to build in, but that's why we encourage you to practice with your staff before they actually start implementing use of the PPE. Okay, so now we're going to take off the PPE, Lisa. So the most contaminated part of her PPE will be the gloves. So ensuring that she is removing those by not touching her skin and just essentially encasing them inside each other, so that the dirty side is all compacted inside there, and disposing of that. And hand hygiene is essential after that removal of each piece of PPE. So again, giving those a nice clean, because as we mentioned, gloves aren't the be all and end all of protection. So giving those a nice clean. And then the next part of that is removing the gown. So removing the securements as planned. Now, if you're using the plastic gowns, they do have a point where you can actually tear those rather than pulling them up over the head. What tends to happen if you pull them over the head is the gown kind of creeps up near your face, which you don't want to do. You want to discourage that. So Lisa is going to remove that by not touching the outside of her gown, only with the sleeves there, and then easing that away from her body and removing the gown. Sometimes they can flap back on and the outside of that can touch your clothing. So the whole point of wearing the gown is to protect your clothing. So pulling that away from your body, rolling it in a nice little package and putting that in the bin. And hand hygiene. And this is where you might want to do the extra part where you're doing your wrists again as well. Next is our eyewear. So we're leaving our face protection last. So grabbing hold of the arms of the eyewear at the back so that we're not touching the contaminated front, and placing that down. And it will be up to your, depending on which point in time you want to clean those, or you may have a receptacle that you place them in. Just depends on how you want to work that with your in your facilities. So we can also discuss that at the individual stations. And again, hand hygiene. And then the last part of that is removing the masks. So you're protecting your mouth and your nose. So pulling those straps together, or your ties, make sure that when people take them off that they are doing them with both sides at the same time, because what can tend to happen is one side might get caught and flip back onto your face. So we want to avoid that at all costs. So removing that, popping that in the bin, and our last part of hand hygiene. Okay, thank you, Lisa.
Got my mic back on. So we'll just finish off the PowerPoint now and just talk a bit about handling disposal of PPE. So make sure you follow your local guidelines for disposal of PPE. Always use PPE and perform hand hygiene when handling your waste, as I mentioned earlier, and discard PPE into clinical waste bins if used during clinical care. This is for the care of suspected, probable or confirmed COVID residents, okay? So if you're not caring for someone with suspected, probable or confirmed, you would follow your normal processes for PPE disposal. But if it is probable, suspected or confirmed COVID, then the PPE must go into the clinical waste stream. And ensure you manage those bins that you're using for the PPE well and in emptying them when they're 3/4 full. I guess the key reminders from the presentation today are for early recognition of symptoms of COVID. The quicker you can identify someone could have COVID, the quicker you can isolate residents, arrange for testing and notify somebody to help. So, and implement your droplet and transmission-based precautions. Always use a buddy to check you're donning and doffing your PPE correctly, and never rush. It is something that can be done methodically and as slowly as you need to make sure that you don't contaminate yourself when you're especially in the removing process of the PPE. Avoid touching your face, eyes, nose or mouth, and it's a good habit to do that at all times anyway. Even when you're sitting here today, try to get into the habit of not going near your face. Perform your hand hygiene as per the 5 moments for hand hygiene, and also when donning and doffing PPE. Always remove your mask last and outside the room if you can. It's really important that if you are caring for a suspected, probable or COVID resident, that you remove your eye protection and your mask outside the room, just to make sure you're away from any aerosols or droplets that may be in the room. Maintain your physical social distance, 1.5 metres. If you're feeling unwell, tell someone, stay home and don't come to work, and please seek medical advice and get yourself tested. Look after yourselves, look after your colleagues, and make sure that you're not putting each other at risk, but also just making sure you are caring for each other. There's e-learning module links on this PowerPoint. The link to the Understanding COVID-19 for Aged Care Workers is there, and also the COVID-19 infection control training. And as I understand, you've done both of those before coming to this presentation today. And also the National Hand Hygiene Initiative e-learning modules, which are excellent. And there's additional modules that you might think are helpful and you might like to actually review as well. The SA Health Infection Control and Personal Protective Advice, that is a really good link. It has PPE matrices for community and also for hospitals, and it also provides links to how you can optimise your PPE and procurement and supply strategies as well, and has an email address where you can source additional PPE should your residential care facility require that. And it has a link to the CDNA national guidelines that I mentioned earlier for residential care facilities in Australia. More links, there's lots of links. The Australian Commission on Safety and Quality in Healthcare Hand Hygiene Initiative, if you would like to look at the hand hygiene program and how that works. And also a key link for you would be the SA Health Aged Care Restrictions webpage, which I'm sure you're probably already familiar with. And more hand hygiene links. There's an SA Health page and a World Health Organisation page as well. And the videos, more educational videos, there's some available from the University of Adelaide, that demonstrate contact, droplet and airborne precautions, and also have a swabbing video on how to take a COVID swab, and also how to hand rub and how to hand wash. So have a look at those as well as the Alison McMillan video. That's the second link for the aged care donning and doffing sequencing, and Tina's video with the source of cross-contamination is the last one there. So that's it for the presentation. What we will do now is we'll move into smaller groups. Oh, actually, we've got questions? We've got time for questions? Does anyone have any questions at this point? No, we might have time to come back after. Oh, we have? Yes.